This week marks 10 years since then U.S. President Barack Obama signed into law his signature Affordable Care Act. Dubbed Obamacare, it was meant to provide access to health care for all Americans. A decade later, millions don't have coverage.
And that's a huge concern in the middle of the coronavirus, right? Because this is a pandemic. It doesn't hit just people who are insured.
Emergency legislation now guarantees that COVID-19 testing for all Americans is free, regardless of health insurance status. But that guarantee doesn't apply to subsequent care. And many Americans who are insured are still unsure of how to get tested. Critics say Washington fumbled in its rollout of diagnostic tests for COVID-19, delaying by weeks the deployment of kits to communities across America.
There is no central entity in the U.S. that makes policy decisions for the whole healthcare system in our country, which makes dealing with an epidemic like this extremely complicated, much more difficult here than in places like South Korea or China.
The Trump administration has largely deferred to state authorities on healthcare matters, offering, quote, federal support. But several state governors have complained they're getting little to no guidance.
Sometimes we have decisions made at the federal level that might conflict with decisions that are being made at the state and local level.
U.S. President Donald Trump faced backlash for appointing his deputy, the vice president, and not a medical professional to lead the national coronavirus response. But Trump's defenders say the president overall has acted correctly and swiftly, with Trump in mid-January introducing health screenings at major U.S. airports, and by the end of January, banning entry to the U.S. of some foreign passengers, a list that later expanded. But was it too little, too late?
One of the reasons we're seeing this huge spike in cases is we were not prepared. We didn't make the investments that we needed to make in public health. Underfunding of public health is a long-standing problem.
These are the people empowered to change that.
They ought to be embarrassed, Mr. President.
But on Capitol Hill, for weeks, lawmakers have been blaming their political foes for the crisis, while trying to rally federal funds for struggling states. The president insists he'll continue his efforts to repeal Obamacare. The Supreme Court this month announcing it would hear the case. Trump still hasn't spelled out what he'd replace it with. Health policy experts warn such ambiguity only leads to chaos and confusion at a time when clarity and order are so desperately needed. Roee, Ruttenberg, CGTN in Washington.